Hi, my name is Michel and I'm a paramedic instructor, and I'm here to talk to you about shock.
Understanding shock.
Shock is defined as a lack of blood circulation. In a normal person, we need three important elements to allow for a good circulation of blood to the tissues. One is the heart as a pump, two are blood vessels to carry the blood, and three is the actual liquid, the blood itself. When there's a problem with either one of these three elements, then you may have a condition of shock, as in the case of having a heart attack, which would affect your heart. If you had an allergic reaction, it may affect your vessels, in which case the vessels then get larger. Or if you have a traumatic experience, such as a crushing injury or a laceration, where you would then lose a lot of blood.
Recognizing shock.
So some of these conditions may manifest itself through the following signs and symptoms. One of the most important signs or symptoms is a diminished level of awareness or level of consciousness. The brain is very sensitive to a lack of oxygen, so any kind of lack of oxygen may make the person become either stressed or anxious, or maybe lethargic or very slow, or in worst case scenario, they may become unconscious. Another sign is skin. So just looking at somebody, you may be able to notice that their skin is slightly blue. Around their lips will become a bluish color, or their nail beds may become blue. And in a person with very dark skin, inside their mouth it may look a little blue. Another condition of the skin may be that it becomes pale, cool, and moist as well. And that's another sign of lack of oxygen going to the tissues or a lack of good blood circulation. Another sign might be rapid respirations. The body tries to compensate by getting more oxygen, and so people will generally breathe quicker. Other signs may be thirst, because the person's losing volume, losing blood. Also nausea and vomiting.
First aid for shock.
Here are some things that you can do to help the body increase circulation and get more oxygen to tissues. The first thing you can do is get help. So call an emergency services in your area. Either call 911 or call the operator, whoever you need to be, to get emergency service to you as quickly as possible.
One of the best things you can do to prevent shock from becoming worse is to give first aid for the cause of shock. If there's severe bleeding, control the blood loss. If there is a problem with breathing, do what you can to make the breathing as effective as possible. If you think the person is having a heart attack, have the person sit or lie down and assist him or her with prescribed medication.
If people are having difficulty breathing, then you can have them a semi-sitting or a sitting position. If they are conscious, you may put them, and having no problems breathing, then you can lay them on their back with their legs raised about 12 inches or 30 centimeters. That will help bring blood back to the core of their heart and to their brain. If the people are unconscious, then you can put them in a recovery position. This will help maintain their airway so they can breathe properly. And lastly, for a patient that may have head, spine, or neck injuries, you might want to just stay with them and not move them. So leave them in a position found.
And remember to cover and reassure the casualty.
Shock is a life-threatening problem, and many of the signs and symptoms are very subtle, but it is usually in late stages of shock that these signs appear. So what you want to do is get help quickly and take care of the patient as best you can.
In summary, shock occurs because of a lack of blood circulation to the tissues of the body. You can recognize shock by the following signs and symptoms. The casualty's level of consciousness. Look for confusion, anxiety, or decreasing level of consciousness. The skin condition. Look for pale, sweaty, or bluish tinged skin. The casualty's quality of breathing. Breathing may be weak and rapid. The casualty's pulse. The pulse may be weak and rapid, and you may not be able to detect a radial pulse. The casualty may experience thirst, nausea, or vomiting. To assist a person experiencing shock, you should immediately call for medical help and give first aid for the cause of the shock. Certain positions will help combat the effects of shock until medical help arrives. If you suspect head and spinal injuries, do not move the casualty. If you do not suspect head and spinal injuries, make them more comfortable with a sitting or semi-sitting position if they are having trouble breathing. Lay them down and elevate their feet, particularly if the shock is caused by a bleeding problem. or if they are unconscious, place them in the recovery position to protect their airway. Reassure the casualty and cover him or her to preserve body heat. Shock is life-threatening and requires immediate medical attention.